Coalition, and also the Senior Communications Advisor for AED Center on AIDS and Community Health. So how we will structure our panel, because we have about 30 minutes, is that folks will open up with some brief comments and some thoughts about some of our successes and some of our areas of strength as Black gay men. So it's more in the model of having a kitchen table conversation, right? And then we'll have some time for some discussion. So we'll start from Mr. Carn and we'll go back.
Okay.
Yes, baby.
Okay, thank you. Just to briefly talk about some successes for NESM. Going way back in 1989, I was approached by a transgender woman. Some of you may remember, her name was Madam. She was very popular in Atlanta, and I was living in California at the time. And she always told me, Rudy, you got to come to Atlanta because nobody's doing anything for Black gay men. So we went back and forth about 2 years. And so finally in 1990, I decided to come back to Atlanta. And she started by introducing me to some of the club owners and other things. And we actually started the agency in December of '89 in my aunt's living room, which is no longer with us. And after she died, afterwards we moved the office to my apartment in College Park. And that was in 1990. Unfortunately, in December of '89, Eddie was killed. Which was very devastating to us, and we sort of decided whether we were going to continue or not. But knowing the importance of the work, we decided to continue. And in January of 1990, I actually quit my job as director of nursing at a nursing home and decided to run the agency full-time. We submitted our first grant in 1990 to the Fund for Southern Communities, and they funded us for I think it was $20,000 case manager. And being a nurse, I actually did home health care back in 1990 also. So I had clients that I actually went to their homes and did IV infusion and some other stuff. So moving fast forward, we were funded first by CDC, I think in 1994, and we've been funded ever since. We were fortunate enough to buy our first house back in 1984. We actually own 5 properties now. So there are Black agencies that do own properties doing something. We're in the process of doing a capital campaign to raise $2 million to renovate our current office building. We own 2 office buildings, and we own 3 housing programs. One is for the drop-in center. The other 2 are for Black gay men that are living with or without HIV for young Black gay men. The other thing I want to talk about, in the early days, 2 of my friends, people don't realize, Ronnie Anderson and Gerald Ludd, who the building is named after. I remember in probably 91 or 92, I called Ronnie in California and said, Ronnie, I have no idea how I'm going to make payroll. I don't know what I'm going to do. Ronnie wired me $10,000 without even asking any questions at all, not knowing how he was going to get his money back. So those are the kind of people that I stand on their shoulders, because if it was not for those 2 gentlemen, we probably wouldn't be here. So I definitely appreciate them. Some of the other successes that we have, we developed a CRIP program, which you'll know about 2 years ago, that it was Roosevelt and I was sitting in Oakland some years ago and decided there needs to be some sort of leadership program for our young Black gay men, and we discussed the CRIP program. And so now I'm happy to say that we're in our 3rd class, and I'm very proud of those young men. So it just really makes me happy to see that. The other success, and my last comment, is we started a drop-in center 4 years ago. And I really didn't realize how many young Black gay men there were in Atlanta. And you know, the first round of money came, I think it was 1163. We sort of said, well, we're not going to do that. When the other round of money came, I started looking and said, we have to do something. And I think in the first year, we had, what, over 600-700 people come through the center in the first year? Ella was our evaluator, so she probably knows the numbers. So, and I think it's something that's very well needed. I talked to young people. We instituted a mental health program, which Dr. Smith talked about yesterday, and Boris said we cannot have any kind of intervention or prevention program that does not include a mental health component. We just can't. Because these young men have dealt with some stuff that, you know, I didn't deal with that stuff growing up, but some of the things they deal with, it's amazing, but it's our job to help them and prepare them for the future. So that's some of our successes that I wanted to share with you.